Hello guys. So I'm gonna be reading the hematological diseases of uh, Kumar and Cloud's medicine book. I already have the digital version, which usually includes the audio, but it's it's really not doing it for me, and I'm pretty sure that there is a lot of other people who would face the same problem. So I decided I'm gonna do like a really good because I'm the kind of person who like gets really bored, gets really bored of like just reading a book, like just reading words. So I usually would like to listen to an audio or a lecture or whatever. So I thought this thing would encourage me and you guys. So let's start. I'm gonna start with the formation of blood cells. Um, Formation of blood cells. Uh, Hemopoiesis. The blood consists of red cells, white cells, platelets, plasma, in which above elements are suspended. Plasma is a liquid component of blood which contains soluble fibrinogen. Serum is what remains after formation of the fibrin clot. The hemopoietic system includes the bone marrow, liver, spleen, lymph nodes, and thymus. So just for your information, liver, spleen, lymph nodes, and thymus usually uh, like the formation of blood cells happens in them in early development, and in adults it's only in like the bone marrow. Okay. There is a huge turnover of cells, with red cells surviving for approximately 120 days. Platelets approximately 7 days, but granulocytes only 7 hours. The production of as many as uh, 10 in the power of 15 new myeloid cells, all blood cells except for lymphocytes per day in the normal healthy state requires that regulation according to the need of the body. Blood islands are formed in the yolk sac in the third week of gestation and produces primitive blood cells which migrate to the liver and the spleen. These organs are the chief sites of the hemopoiesis from 6 weeks to 7 months gestation. When the bone marrow becomes the main source of the blood cells in childhood and adult life, the bone marrow is the only source of cells in the normal person. At birth, hemopoiesis takes place in the marrow of nearly every bone. As the child grows, the active red marrow is gradually replaced by fat yellow marrow, so that the hemopoiesis in the adult becomes confined to the central skeleton and the proximal ends of the long bones. Only if the demand of blood cells increases and persists to the areas of the red marrow extent. Pathological processes interfering with normal hemopoiesis may result in resumption of the hemopoietic activity in the liver and the spleen, which is referred as the extramedullary hemopoiesis. All blood cells are derived from the pluripotent stem cells. These stem cells have two key properties. The first is self-renewal, that is the production of more stem cells, and the second is proliferation and differentiation into progenitors. progenitor cells committed to one specific cell line. Pluripotent pluripotent stem cells differentiate into mature cells through the intermediate progenitor cells, which have lost the ability to self-renew but have high proliferative capacity. These progenitor cells can be broadly classified according to blood cells that are programmed to make. See figure 16.1. Okay, so this is the hemopoietic stem cell. Again, uh, it produces the multipotent progenitor, which uh, make the common myeloid progenitor and the lymphoid prime entity. So, we learned previously that every day 10 in the power of 13 myeloid cells are produced like daily, which includes all the blood cells except the lymphocytes. And the common myeloid progenitor then derive or produce the megakaryocyte erythroid progenitor and the granulocyte macrophage progenitor. The megakaryocyte erythroid produce the megakaryocyte and the erythroblast. The megakaryocyte produces the platelets and the erythroblast produces the erythrocytes. Granulocyte macrophage progenitor produces neutrophils, eosinophils, basophils, dendritic cells, which is the macrophage. And the common lymphoid progenitor produces the B cell and the T cell progenitors. By the B cell produces the B lymphocytes and the T cell produces the T lymphocytes and the NK cell. So yeah, bone marrow aspiration and biopsy. Okay. Um, this is generally carried out as an outpatient procedure under local anesthetic, anesthetic using aseptic technique. Consent, consent consent is obtained, and then the skin overlying the posterior airway crest is cleaned, and local anesthetic injected subcutaneously and along the periosteum, which is extremely well innervated. Once the area is numb, an aspirate needle is used to obtain the liquid sample. The sample is spread on the slide, stained, and examined under the microscope for morphology. What sample is also sent for cytogenic analysis, and a karyotype is generated, allowing identification of cross chromosomal rearrangement, such as stain on rows of chromosomes or translocations. A trypsin needle is needed to obtain the bone biopsy, and the biopsy is a hard core of bone which must be decalcified in the chelating solution before being embedded in paraffin. Selection are then Selections are then cut and stained, permitting the architecture of the marrow cells to be examined and the immunohistochemistry to be carried out to detect normal cell population. Okay, this is A, which shows like the procedure. Then B, the um, the slides and how it's like C, the C shows the karyotyping. D shows the needle, I guess. D, yeah, the therapy needle is needed to obtain a bone biopsy. And E, the biopsy is a hard core of the bone, which must be declassified and collagen solution in collagen solution before being embedded in paraffin. Selection are cut and sustained permission the architecture of the bone model. Okay. Hemopoiesis arises from multiple stem cells which give rise to different blood types according to the percentage of the internal and the external regulatory molecules, hormones, and cytokines as such. Cell numbers are closely coordinated in response to rapidly to changes in requirements. EPO, which is the erythropoietin, FLT3, FMS like tyrosine kinase, and GCSF granulocyte colony stimulating factor, GMCSF granulocyte macrophage colony stimulation factor, IL interleukin, MPP multipotent progenitor, NF natural not neutral killer, SCF stem cell factor, TPO thrombobiopsy. So let's get back to what we were saying, that the progenitor cells can be further classified according to the blood cells that they are programmed to make. For example, the common lymphoid progenitor. The common lymphoid progenitor, which is derived from the multipotent germ cell. Yeah. No, it's derived from the lymphoid primed progenitor parent to the lymphoid progenitor. Rises from the T gives rise to T and B lymphoid cells. The former are produced in the thymus, whereas the B cell production primarily occurs in the bone marrow. The T lymphocytes from the thymus, T lymphocytes. No, the former thymus, T thymus, B to the bone. The common myeloid progenitor gives rise to all lymphoid cells of the bone marrow. They are a series of intermediate progenitor cells. These cells cannot be identified in bone marrow biopsies but are recognized by their ability to form colonies reflecting their high proliferative capacity. When the hemopoietic cells are immobilized in a soft gel matrix, the so-called colony-forming units, which are named according to the type of the cell that they produce. These hemopoietic cells, stem and progenitor cells, interact closely with a number of components contained within the specialized microenvironment of the bone marrow, including the non-hemobiotic stromal cells, blood vessels, and extracellular matrix, together creating a nurturing microenvironment for the blood cells' development. Central to this microenvironment are the hemobiotic growth factors produced by the stromal cells in the in the bone marrow, and elsewhere, okay, which are the key regulator of the blood cell production. Hemopoietic growth factor. The hemopoietic growth factor are the glycoproteins which regulate the differentiation and the proliferation of the hemopoietic progenitor cells and the function of the mature blood cells. Some growth factors are presented in the circulation, whereas other growth factors are produced within the blood, the bone marrow microenvironment by the stromal cells such as the fibroblasts and the osteoblasts, and the endothelial cells are outside of the inflammation by the activated T cells, monocytes, and macrophages. Growth factors act on the responsive respective cell surface receptors expressed on the hematopoietic cells at various stages of development to maintain the hemopoietic progenitor cells and to stimulate increased production of one or more cell types in response to stresses such as blood loss and infection. This hemopoietic growth factor, including the erythropoietin, interleukin 3, 6, 7, 11, 12, beta catenin, his name, let's see what is it from here.
Catenin, stem cell factor, SCF.
Catenin. Stem cell factor, SCF, which is the steel factor or c-kit ligand. The, M- the FMS like tyrosine kinase activate the specific receptor on cells surface to stimulate the downstream signaling within the cell, such as the cytoplasmic drainase kinase. Drainase
Janus Kinus, Jack, pathway.
pathway. This in turn activates the signaling cascade within the cell. I'm gonna do something. I try to see my uh, hematology. Yeah, this one. So we still didn't get to the point of my. Okay. Sorry, I get bored. Let's continue this chapter and then we're gonna have the electrophoresis for another video. So this in turn activates the signaling cascade within the cell, ultimately altering the gene expression. In the cell, nucleus and fat influencing behavior of the cell. For example, to promote proliferation, clonal stimulating factors CSFs, the prefix indicate the cell type, item, as well as the interleukins and the erythropoietin, regulate the lineage-committed progenitor cells. Thrombopoietin is produced in the kidneys, liver, and certain bone marrow stromal cells and acts on control the platelet production, along with the interleukin 6 and interleukin 11. In addition to these factors which stimulate the haemopoiesis, there are other factors that inhibit the process. These include the tumor necrosis factor and the transforming growth factor. Uses in treatment, many growth factors have been produced by recombinant DNA techniques and are being used clinically. Example, the granulocyte granulation stimulating factor used to accelerate the hematopoietic recovery after chemotherapy and hematopoietic cell transplantation. Erythropoietin used to treat anemia in patients with chronic kidney disease and in patients with certain blood cancers, while thrombopoietin receptor agonists used to treat immune thrombocytopenic purpura. Thrombocytopenic purpura. The peripheral blood. Automated cell containers are used to measure the hemoglobin concentration and number size of red cells, white cells, and platelets. See the box in 16.1 diet. Normal pulse values for the peripheral blood. The hemoglobin in gram per liter. The male should have uh, 135 to 175 gram per liter. Female 115 to 155. The packed cell volume اللي هو الهيموكريتيك 1.5 to 1.4 to 1.5 and females from 1.37 to 1.47 like 3 out of 100 oh red cell count red cell count um, measured by the 4.5 to 6. So you can check this by yourself, like the mean carboxyl volume of red cells, the pt.296, mean carboxyl hemoglobin, mean carboxyl hemoglobin concentration, red blood cell distribution width, white cell count. Red cell count is, doesn't change female and male, but it's similar to the red cell count. It's from 4 to 11. Platelets mean 150 to 400. And erythrocyte mutation rate more than less than 20, while reticulocyte 0.5 to 2.5%. Other indices can be derived from these values. A blood film examined by the hematologist or technician experienced in blood cell morphology is still an essential adjunct, adjunct,
Adjunct to the above.
adjunct as decorative abnormality can be seen. This is particularly important in some hematological emergencies such as acute promyelocytic leukemia, see page 391, or thrombocytopenia purpura, which requires specific therapy within hours of diagnosis to prevent the high rate of mortality. Therefore, about the total magnification of 400, showing the Rolex formation in the red blood cells, um, which is this. I, I wish I can point it, but unfortunately I can. Instead of increased blood concentration and infection, infection, paraprotein and the destroyed red cells back together like coins. The mean carboxyl volume of the red cell is useful index and it's used to classify anemia. The red cell distribution width is the measure of the variability in size of red blood cells. Elevated RGW suggests increased variation in red cell, that is aneuploidy, and this is seen in the iron deficiency. The white cell count for white blood cell count gives the total number of circulating leukocytes in addition to differential counts, specifically enumerating neutrophils, monocytes, lymphocytes, and eosinophils and basophils. Reticulocytes are young red cells and usually compress less than 2.5% of the red cells. The reticulocytes give a guide to electrolyte activity in the bone marrow. An increased count is seen with increased marrow activity, for example, following hemorrhage or hemolysis, and during the response to treatment with a specific hematinic. A low count is in the presence of anemia indicates an inappropriate response by the bone marrow and may be seen in bone marrow failure from whatever cause or deficiency of the hematinic. The erythrocyte mutation rate is the rate of fall of red cells in a column of blood and is a measure of the acute phase response. The pathological process may be immunological, infective, ischemic, malignant, or traumatic. A raised ESR reflects reflects an increase in the plasma concentration of large proteins such as fibrinogen and immunoglobulins. These proteins cause uh, Rolex formation where red cells clump together and therefore falling more rapidly. The ESR increases with age and is higher in females than in males. Plasma viscosity is a measurement that is used instead of ESR, erythropoietin secretion rate. In some laboratories, it is also dependent on the concentration of large molecules such as the fibrinogen and the immunoglobulins. It is not affected by level of the hemoglobin. C-reactive protein is a protein produced exclusively in the liver and rises within 6 hours of an acute event. And the CPR and the CRP level rises when fever possibly triggered by interleukin 1, 6, tumor necrosis factor alpha, and other cytokines in inflammatory condition and after trauma. It follows the clinical state of the patient much more rapidly than the erythropoietic exercise mutation rate and is unaffected by the level of the hemoglobin, but it is less helpful than the ESR or the plasma viscosity in measuring the chronic inflammatory disease such as ischemic lupus erythematosus. So this is it. We finished with the first chapter of like hematology, which is the introduction and the formation of blood cells. I'll get back to you with another video about the red cells, the red blood cells. So see you and bye.